Hello, my friends. This is William Lee with the Grand Duke Dmitri Diary Series. It is the 5th of May, 2025, and it's actually snowing outside. Although it's not going to stick. It's not going to accumulate. I don't think. Well, we'll see. I'm in Davos, Switzerland, at Hotel Schatzalp. Up on the side of a mountain, and it used to be Sanatorium Schatzalp. And this, as any of you who have read up on Dmitri or who have been following this video series, you already know that he came here in September 1939, and then he died here in March 1942. So it's a happy place for me. It wasn't really a happy place for him, unfortunately. I am the historian in residence here for about 3 months a year, usually in the spring and the early summer. So that's what I'm doing here now. And the hotel is closed to the public. It is open seasonally. There's a summer season and a winter season, and between seasons it is closed. So that's why I really am free now to move around and record wherever is most suitable. So that's great. There's a bit of an echo in here, as I've just now noticed. So sorry about that. There are there's a ground floor and then 3 floors with guest rooms, or as they would have been in the sanatorium era, patients' rooms. And so I'm actually in the first floor corridor. And yeah, I'm gonna have to do this with a selfie stick at some point and walk around so you can see what I see. But it's just a nice long corridor. And I decided to sit down and do this here because what you see behind me pertains to something that Dmitri talks about today, and it's you'll find out about that. I guess I would call it a spit sink, but not like the kind that you used to have in dentist's office before they used suction, when you used to have to actually spit into a sink. This is not a sink that people spit in. It's a sink that the nurses use to clean spit receptacles. So not a pleasant subject, but that was the reality. And I think it's really thick marble, I think, with this beautiful Dutch tile around it, and not in use. In fact, I took down this sign which is asking hotel guests not to try and use it. It's strictly historical, and it's one of the reasons I love Schatzalp, because of the amazing level of authenticity to it, what its historical purpose was. Okay, so what we have today is not actually a diary entry. It is a letter, a fairly long letter, and I think a very touching letter that Dmitri wrote to his sister, Maria. The date is 23rd of September, 1939. He had been at Schatzalp about 3 weeks, so it was still new to him, but he was getting the hang of things. He was learning how everything worked. And it's a nice long letter, so we're going to have to do it in several parts. It starts out in what he starts by describing his last few days in Paris. And he'd been dividing his time pretty much between, he was divorced, he'd been divorced for several years by this time, and he more or less divided his time between Monte Carlo and Paris. And he no longer could live at the chateau that he and Audrey had owned, Beaumesnil, and so he was basically living in hotels in Monte Carlo, and in Paris he lived in the Georges V Hotel, which is still a thriving and very prestigious hotel. If you happen to be in Paris and you're wealthy, go and stay there. If you're not wealthy, you can at least go and have a look at it. I've never been able to stay there. Anyway, that was what he was doing before all of this happened. And of course, this was written on the 23rd of September, and the German invasion of Poland, which ignited the Second World War, occurred on the 1st of September 1939. So we'll be hearing more about that from Dmitri himself, so I'm not going to anticipate that, just that you know that this was a very fraught time for him, both personally because of the disease and in a general sense for everybody who was in Europe because of what was going on. Okay, so bear with me. I think it's important to do some preliminary before we dive into the letters and diary entries from Dmitri's time, the diary entries and the letters from Dmitri's time at Schatzalp. I think it's important to sort of lay the groundwork, and I thank the two of you who responded to my request to weigh in on whether to go backward or forward in time when we finish the 1921 diaries, and I still may do some of the 1915. The diary entries, the letters are long, but the diary entries from 1939 and 1940 are pretty short. So, we'll be learning a lot from them, but it may be that I can fit in some of 1915 as well. Anyway, what do you need to know about sanatoriums and about tuberculosis? Well, in 1939, about 80% of the population of the world were infected with tuberculosis. They carried the bacilli, but it had been effectively shut down by their immune systems, walled off, usually in a sort of calcium capsule. And only about 10% of the 80% of people in the world who were infected would ever develop active disease. So Dmitri, there were several people in the Romanov family who had tuberculosis, and he almost certainly was infected when he was a child. But the disease was then effectively reduced to a latent state by his immune system, and it didn't become active until he was an adult. In his probably the doctors estimated that he'd probably had an active form of the disease for about 10 years. And that's another thing that needs to be said about tuberculosis, is that it can run a slow course. It can run a slow and chronic course. It's a disease that manifests itself in a great many ways. You can have what was called galloping consumption that killed you quickly, or you could have a slow chronic course of tuberculosis that you had for years until it finally reached the point that you had to acknowledge there's something seriously wrong and you needed to look for treatment. So in many ways, it's a disease that is similar to cancer. It can be in any part of the body, not just in the lungs. It can be in the brain. It can be in the genitourinary tract. It can be in the eyes, the skin, the bones. In fact, childhood tuberculosis was very often in the bones. And in the stomach, in the digestive system, in the throat. So in that respect, very much like cancer, and also in the respect that it can spread to other parts of the body. It can also be in the blood. And if you have it in the blood, that's something called miliary tuberculosis that tended to kill people quickly. It would go to their brain. It would be particularly devastating in the lungs. And so fortunately, Dmitri did not have miliary tuberculosis. But yeah, so like cancer, cancer obviously is not an infectious disease, but like cancer, it can go into remission. And that was the goal of sanatorium treatment, because at that time, pre-antibiotics, antibiotic treatment would be coming soon. A little too late for Dmitri, unfortunately. But it couldn't be cured. In 1939, tuberculosis could not be cured. You were not going to get rid of the infection. But it could be returned to latency. It could be, again, successfully walled off by your immune system. And so that was the goal of sanatorium treatment. And then, they would test your saliva and other things to see if they could still detect the bacilli in your body. And if they couldn't, then you weren't contagious. And the disease was in remission, and you could leave the sanatorium and you could live sometimes to a ripe old age. So that was the goal that everybody was striving for who was in a sanatorium. So there was a similarity to cancer. And it was also a disease that if you went to the doctor and you had some kind of complaint and you had a good doctor, even if it was a skin thing or, something like that. The doctor would want to rule out two things. He would want to rule out tuberculosis, and he would want to rule out syphilis. So there was a test called the Wassermann test for syphilis, and Dmitri would certainly have had that. That would have been one of the very first things. The first time he went to a doctor, complaining about this fever and these symptoms, they would have tested him for syphilis, and obviously he didn't have syphilis. So good. Syphilis was actually called the great imitator at that time. I don't know if it still is, because it could imitate so many different diseases. And tuberculosis could have been called a great imitator as well, because it was often quite difficult to diagnose. Whether a person had, say, a fungal infection of the lungs, or a disease of the kidneys or the stomach or what have you that was non-tuberculous. Even with these tests that could hopefully pick up the bacilli, and they weren't always successful in doing that. Sometimes a person would have consistently negative tests, but they would have TB, and eventually the test would be positive. Anyway, even in 1939, it wasn't an easy disease to diagnose in many cases. But Dmitri really did have it. You would have found a lot of people in tuberculosis sanatoriums that didn't actually have tuberculosis. It was a misdiagnosis, but Dmitri definitely had it. He had it. Okay, so sanatoriums, both public and private, offered really at that time the best chance at remission. And the idea was that you just had complete rest. And in a healthy environment, you ate a lot because it's a wasting disease. That's why it's called consumption. They fed you constantly, and you had complete rest, and you were in good, healthy mountain air. The climate and also the altitude were supposed to be quite beneficial. And so Davos was a sanatorium center in Switzerland, the best known. There was another one in the French-speaking part of Switzerland called Lausanne. And of course, there were other sanatoriums spread around the country, but the two centers were really Lausanne and Davos. And Davos had the most luxurious private sanatoriums that were like grand hotels. So Schatzalp was probably the most luxurious sanatorium in Switzerland at that time. And it also had public sanatoriums for people whose treatment was paid for from other sources, not by themselves. So this is where Dmitri was coming to. Only the best for him, right? He was a Grand Duke. There had been other royalty at Schatzalp, and so that's where he came. More on that later. So the themes that we're going to be encountering in this letter, well, the war, of course, and death, and a premonition of death that he had. New thought philosophy, which had become very important to him. It had been very important to him as a young man right after the revolution, when he was trying to just deal with this overwhelmingly negative psychological trauma. And it became very important for him again when he got ill. So, this is a particularly touching letter because he knew he was probably dying, but he just wasn't going to give up hope. He wasn't going to do that. And so, good for him. And now I've talked for 15 minutes. So maybe I'm going to leave the first part of this diary entry till next time. Okay. Well, I'll read just the opening. My dear one, God only knows when this letter will reach you, though it seems the Italian ocean liners are still sailing. Now you know why I have written you so rarely, or to be truthful, not at all, up to this point. It was because of a silly feeling on my part that the whole exercise would be pointless, given how much the circumstances might have changed by the time the letter even reached you. But now I can pretty safely say that the war will still be going on 2 weeks hence, and I'll still be here in Davos, so nothing will have changed all that much. I'll begin at the beginning, exclamation point, and I'm going to stop there. And yeah, just so you can see, he didn't have confidence that the letter would reach her quickly because the whole disruption of the war, and apparently, the assumption was that it would go by sea rather than by air, and it would take a while to reach her. And so if it's going to take 2 weeks to reach you, then why should I write you at all? Because by the time you get it, things will already have changed. And I think he was thinking, maybe I'm not going to stay at the sanatorium. We'll check it out anyway. But yeah, so this is why he says a little bit ironically is, the war's not going to go away, and I'm not going to be well enough to leave the sanatorium within 2 weeks. So yeah, I'm going to go ahead and write. Nothing will have changed all that much. Okay, I'll stop there. Thank you for bearing with me with all of this conversation. I'm not an expert on tuberculosis, but in my historical work here at Schatzalp, I've educated myself as much as I can and talked to people who are experts on it, but apologies for any shortcomings in my presentation, and I hope to see you next time. Bye.